Hi, my name is Nicole Guashiri, and I am the Family and Consumer Sciences Extension Agent in Bath County, and this is our monthly Medicare Minute program. And we have Sasia Hollenberg, who is the leader of this program for us in Bath County. And I will let Sasia tell us more about herself and everything else. So, Sasia, take it away.
Thank you so much, Nicole. I appreciate that you are having me again here, and I hope you have a blessed day. Today, we're talking about late enrollment penalties. Before we go into this, I'd like to introduce myself a little bit. My name is Saskia Hollenberg. Yeah, I know I have a very long double hyphenated name. I live here in Ellingsville, actually in P-Sticks. I'm an independent insurance broker, and I have active licenses not only in Kentucky, multiple other states like Ohio, Tennessee, North Carolina, Virginia, West Virginia, Florida. So if you travel or if you move or if you have family in other states, I can help out too. I really love to help folks with their insurance needs in general. And I love to share information about Medicare since it is a difficult subject to understand, and it's such a big subject. I originally come from management background, and as I mentioned, I live in P-Sticks here in our wonderful, beautiful Bath County. And originally, I'm from Germany. Everybody probably knows that. And the ones who don't know, they might hear a little bit of an accent. I come from the mountain area, Bavaria. And we have 2 horses and 3 rescue dogs, a ton of chickens. And when I have time, I do love to garden as well as canning. I love to knit. So here's a little bit of my personal life. This year down here is Sandy. She's our newest one. And here are the 2 boys, my horse, just to give you a little bit of an idea how my lifestyle is. This is, by the way, my brother. He lives in Germany. And again, I have multiple other states I can offer my service to. A little few testimonials from some clients. They are very happy. And today's subject is late enrollment penalties. This is something I have very often being asked about. I really meet a lot of people they're actually not aware of that there are penalties. And if they do know there are penalties, there's often misinformation. So I thought this would be a good subject for this month to give you a little bit more information. So what are there? So if you have not signed up when you were eligible for certain parts of Medicare, you will endure late enrollment penalties. And that goes for Part A, which is the hospital part. That goes for Part B, that is the outpatient insurance, which also covers MRI, CAT scans, outpatient surgeries, and Part D for the prescription part. The Part B, like a boy, late enrollment penalty, and we call it LEP. If you don't get Part B when you first are eligible, your monthly premium will go up 10% for each 12-month period you could have had Part B, but you didn't sign up. Now, again, there's always exceptions through the rules, so don't panic. Just go through the presentation with me here. There are exceptions to the rules, but I think this is important information for everybody to have. So in most cases, you will have to pay this penalty each time you pay a monthly premium, as long as you have Part B. Now, I'll give you an example because this is always hard to understand how these penalties are calculated or worked. And ultimately, really, Social Security will do these calculations. So I normally only can give an approximately amount. So let's say your initial enrollment period ended in December 2016. You waited to sign up for Part B till March 2019. And then the coverage starts July 1st, 2019. So your Part B penalty is 20%. because you had actually 31 months, oops, sorry about that, 31 months no coverage, but it will count only 2 12-month periods. So you will have 20% more on top of your monthly Part B premium, which currently is $148.50. There are always, as I mentioned before, exceptions to the rules. If you're covered, for example, through an employer group coverage, either through yourself or through your spouse's current employment, you can sign up anytime while you're covered under the plan. You can sign up within 8 months after the loss of coverage or the loss of employment, whichever happens first, and you will not occur a late enrollment penalty. Now, I will tell you, this is very important. A lot of people are not aware of that. You will get a letter from your employer at that point stating you had credible coverage from day A to date B. This letter really is important for you to keep. You will need this for the future. Every time you're changing a plan, every time you might need to have a copy on hand. Another exception is if you have limited income or resources. Your state may help to pay your Part B premium. And again, these numbers are changing every year. For 2021, the monthly income limit is $1,308 for individual and $1,762 for married couples. I know everybody is now saying, oh, I get that. You have to understand these numbers are before anything is taken out of your Social Security check. So if you, for example, get $1,308 in your bank account, you need to consider that your $104.50 for your Part B premium was already deducted. Okay, so that is, the number is before your Part B premium or your health insurance payment is being taken out. Resource limits for 2021 is $7,970 for individuals and $11,960 for married couples. This part is actually a part of your Medicare savings program, and I did a presentation about this before, and I think it's time maybe that we're gonna repeat that because there is always a lot of information requested. So you may also qualify for extra help to pay for your Medicare prescription drug coverage at that point, and that is actually a federal program. Part D, late enrollment penalty, you may also, on top of your Part B penalty, you may also owe a penalty if you have at any time after your initial enrollment period ends. There is a period of 63 days, consecutive days, where you did not have credible drug coverage. So if you had coverage from your employer, but you had for 63 days no prescription coverage instead of the 8 month, you see where I'm coming from, you have actually on top of it another penalty. You will generally have to pay the penalty as long as you have Medicare coverage. And the Part D late enrollment penalty, the cost really depends on how long you went without your Part D, like a dog, like drugs, drug coverage, and it is calculated as a 1% national base premium. So the average prescription drug premium for 2021 is $33.06, and they're calculating 1% of that times the numbers of full months you did not have Part D credible coverage. Now, first of all, that can change. The average prescription drug coverage price changes every year. So that means also your penalty is changing every year. And the penalty will be rounded to the nearest 10 cents and added to your monthly Part D premium. Here's why this is important, and this is something out of my, my office. What I see quite a bit is that I have quite a bit of folks there saying, I'm healthy, I really don't need any prescriptions, I don't take any prescriptions, I don't need a drug plan, I need to pay for this. And this is actually a perfect example. After 10 years, all of a sudden you then need some prescriptions. They are expensive. You need a drug plan. And then you get actually hammered with these late enrollment penalties for prescription plans. So please keep that in mind when you make decisions. Here's an example for the late enrollment penalty for the prescription plan. Your initial enrollment period here, for example, was ending in May, end of May 2017. And you signed up for coverage January 1st, 2020. You were 31 months without coverage, and the penalty would be $10.30 for each month in 2021. And so your base premium for the prescription, for the, the average prescription drug plan cost is $33.06. So your 1% is 31 cents times 31 months. That's how you are ending up with $10.30. And again, that will be added to your cost of your current monthly premium. Again, there's exceptions to the rules. First of all, again, if you do have union or employer group coverage, also state pharmaceutical assistant programs in your health services, if you have VA coverage or TRICARE for life coverage, or individual health insurance coverages. All these other additional coverages will eliminate your Part D late enrollment period. But again, keep in mind, these things need to be, proven. So you need to have some kind of letter or something like stating that you have coverage through the state pharmaceutical assistant programs, etc. Another exception is, and that is something what I see quite a bit, and this helps a lot of folks out. If you have limited income and resources, you may qualify for extra help. That is, as I mentioned, the Low Income Subsidy, also called LIS. And that is if you have less than 150% of the federal poverty level, the resources less than 13,920 for individual, 26,520 for married couples. As long as you qualify for the extra help, you do not owe a late enrollment penalty. Now, Part A, remember that is the hospital part. Normally, you qualify for premium-free Part A as long as you worked 40 quarters, which is 10 years. You paid 10 years into the system. And now, but there are folks, they might have not qualified for it. They haven't worked long enough, self-employed. That's what I see it quite a bit is. And you are qualifying at that point, and you're eligible for Medicare, and you do not qualify for your premium-free Part A, you will actually add another 10% premium. So you will have to pay the higher premium for twice the number of years you didn't sign up. Example. This is difficult, a little bit difficult, they made that. So an example is you had eligible for Part A for 5 years, but you did not sign up. You will pay the 10% penalty for 10 years. Here we go. We have again exceptions. You were covered again through your employer group coverage, and you can then sign up anytime while you're covered under the plan. You can sign up within 8 months after the loss of your coverage or your employment, whatever happens first. and you will not incur a penalty. Again, make sure you keep that letter from your employer. Also, again, you will have an exception for the late enrollment penalty if you have limited income or resources. And here again, the state might help with that to pay for Part A premium. The income limit for Part A is $1,094 for individuals and $1,472 for married couples. The resource limit as $7,970 for individuals and $11,960 for married couples. Again, this is part of the Medicare savings program. And on top of this, you probably will qualify for extra help for the federal program for your prescription drug coverage. Now, if you had that happen to you and you say, listen, this is no way right, the numbers are not right, there is an appeals process, and you can do that for your Part A and Part B through your Social Security office, and I have the number here on the screen. Or for Medicare Part D, you can work with your prescription drug coverage carrier. Here are a few other resources we put together for you. And I wanted to bring one more thing up since we briefly addressed prescription drug coverage. I can offer, this is not insurance, please. This is just a discount card. If anybody is interested to just have an extra discount card, it's a free service I offer. You're more than glad to contact me and say, listen, I would love to have the Clever X card. You can have it as an app, as a little card, and there are savings possible up to 80% for prescription drugs in certain pharmacies. This is just a little bit of a service what I'm doing. If you have questions, you can either put a little note in the comments. Nicole will forward those to me. You can also call me. Here's my information, or you can email me. I'm on Facebook and under Your Insurance Lady LLC. And my name is Saskia Hollenberg, and I'm looking forward to seeing you next month again. Nicole, thank you so much for having me. And I hope this information gave you some new thought process. Maybe you also were able to pick some things up for some friends or family members. Thank you so much, and I hope you have a great day.